morning, everyone, and welcome to today's webinar presentation on the Parents Under Pressure program, supporting complex families, improving outcomes for children. My name is Sarah Carsley, and I am an Applied Public Health Science Specialist for Public Health Ontario, and I have the pleasure of co-moderating today's session. Before we begin today's presentation, I'd like to acknowledge and respect the lands, sky, and waters of Ontario, including for their contribution and sharing to support all life within. I acknowledge and respect the treaty, unceded, and traditional territories of all First Nations across these lands and waters. I acknowledge and respect the traditional territories and communities of the Métis Nation of Ontario. I acknowledge and respect Inuit connection and contribution across these lands and waters. Please join me in acknowledgement and respect of all Indigenous peoples, their life journeys, worldviews, and ingenuity. May we respect and honor the many connections, relationships, and life journeys of Indigenous peoples and their indigeneity to the lands, sky, and waters across all Ontario since time immemorial to this very day. May their wisdom always guide our own paths forward with open hands, open hearts, and open minds for the mutual success and benefit of all in Ontario. Lastly, I'd also like to acknowledge Daniel Coles, who is the author of this land acknowledgement, and thank him for sharing it with us. I will now mention a few housekeeping items before we begin. To enhance the presentation experience, participant audio video has been disabled. We encourage participants to submit content questions through the Q&A function at the bottom of the window. We will address these questions during the discussion and question period following the presentation. If at any point during the session you experience any technical issues, please email capacitybuilding@oahpp.ca. I would now like to introduce my co-moderator for today, Dr. Andrea Gonzalez. Andrea is an associate professor in the Department of Psychiatry and Behavioral Neurosciences at McMaster University. Her work focuses on parenting, early child development, and preventative interventions, and she is currently leading a feasibility and acceptability study of parents under pressure in the Canadian context. Over to you, Andrea.
Great. Thank you so much, Sarah. I'm really thrilled to be here today co-moderating with you for this webinar, which will provide an overview of the underlying Parents Under Pressure, or PUP, program logic. It will introduce the construct of case conceptualization to develop individualized therapeutic family support plans, and provide a brief overview of the research evidence supporting the PUP program and underlying therapeutic mechanisms of change. It is now my pleasure to introduce the two speakers for today's presentation, who are here from Australia. They're actually here in Canada. We're in the same hotel room, or same hotel, but different rooms. Professor Sharon Daw and Jenny Carpenter. Professor Sharon Daw is a clinical psychologist and academic at Griffith University. Her clinical work focuses on supporting the development of young children and toddlers by supporting parents and caregivers to provide a safe and nurturing environment. She is the co-developer of the Parents Under Pressure program, designed for complex families that include parental substance misuse. Jenny Carpenter is a social worker with extensive experience of provision of family support to families with parental substance misuse, and has been training practitioners in the PUP program for over 10 years, including the practitioners who are involved in our study here in Canada. So I just wanted to say welcome. Thank you everyone for attending, and I will hand it over now to Jenny and Sharon.
Well, good morning, Canada. It's absolutely wonderful to be here and to have an opportunity to share some of our journey on the PUP program with you here. Jenny and I are going to do a little bit of a tag team. And so I'm just going to start off by setting the scene, and then we'll hand over to Jenny, and then I'll come back on. So do save up your questions. We'd like to hear lots of ideas and thoughts that you have about the PUP program, and are really curious about the fit that an Australian developed model may have within the context of Canada. So if you're joining this webinar, it's probably because you are working with complex families, and complex families and messy lives often involve lots of chaos. And certainly my experience and Paul's experience many years ago when we first started in this field was pretty similar to what we've got down there. You just felt like you were lurching from one crisis to the next, and you were putting out fires. And so it didn't really matter how well intentioned you were or how good your parenting program was that you were drawing from. And back in those days, it was very much a behavioral parent training model. You still had to face the complexities of day-to-day living, where there might be imminent homelessness, a child was being expelled from school, a dad was being let out of prison with a very significant drug problem. And you know, it became a question of, well, what do we do? Where do we start? How do you ignore these really major, significant life problems, but how do you stop yourself from getting trapped in a perpetual sense of firefighting? And along the way, how do you help parents themselves to start to feel empowered and that they themselves can be great parents? So that was kind of like our problem, really, that we were really struggling with. We realized pretty early on that it wasn't about a systematic program that you worked through, starting at the beginning, moving through comfortably to a middle point and then an end. You needed something that was going to meet each family's needs at the point of entry. And certainly in our experience, families don't usually welcome you with open arms. Ah, social services, come in, lovely, delighted to see you. In fact, what we typically find is a great reluctance, and the engagement process can often be really challenging. And so it became even more important in the context of child protection and child protection concerns that you gave families something that they wanted straight away. But again, how do you stop this firefighting problem? So we arrived at a view that what you need is a framework. And so that framework needed to be all of those 3 dot points. And in that process, what you could do would be different and tailored for each family. So a family with a 5-year-old, for example, who was going to be expelled from primary school for third expelling, you know, that bodes really badly educationally for that little 5-year-old. So that might be your point of intervention. This is where you might be starting. There's lots of things happening in this family, but we really need to, let's work hard on working out how we can get Jimmy to stay in the school and maybe do some problem solving around that. For another family, it may be, I've only got another 3 weeks and then I'm going to be homeless and my housing applications got lost in the system again. And so then it becomes a question of, well, we know Johnny's behavior is really out of control. This little kid is facing all sorts of problems, but really what we need to do is prioritize the housing. So you need something that is going to be adaptable. And this is where we arrived at integrating a range of theoretical models where we draw from attachment theory, where we draw from our understanding and knowledge about adult psychopathology, and we embed that within a kind of developmental model for children and embedded in a kind of wider ecological model. So all of that sounds like really big deal and complicated, but actually what the real challenge for us was to try to distill a number of complex theoretical models into something that was going to be accessible to practitioners and accessible to families. So I'm going to hand over to Jenny now, who has spent a lot of time working with practitioners with our integrated theoretical framework.
Hi, it's lovely to be here, everybody. Lovely to have the opportunity to present to you today. So in a way, I'm going to give you a little bit of a flavour of what we would do in a typical training session with frontline practitioners from various services, actually, across addiction, across health, across social care, family support. And some schools, trauma-informed schools, are starting to come in as well. So it's a really interesting mix of practitioners that we're working with in the front line. So we present this model, and a way to think about this is that we're representing at any point in a child's trajectory from birth through their childhood, at any point, if we stop and consider them in the context of their full family environment, we're thinking about 6 key domains of family functioning that are represented on this framework, and we're going to break it down layer by layer. And if it was a typical training session at this point, I would be inviting everybody in the room to hold in mind a child that's known to them, a child that they're working with. And that we're going to think about that child in the context of their wider family and the relationship with their key caregivers. But for the moment, to start with, no matter what brings a family to our services, no matter what brings them through our front door, and actually no matter what our remit is, what we're interested in is building up an understanding across these different areas of family functioning in order to contextualize the presenting issues and understand the underlying mechanisms that may be going on behind them. So in terms of at the point of delivery for a family, that means that as a family comes to a service, what they get from a practitioner is a curiosity and an inquiry in their whole experience and their whole situation. So with trainees, we would say, think about a child. Think about their age and stage of development. Think about their physical presentation, their fine motor skills, their gross motor skills, their abilities, their physical levels of activity or not. Think about them in their behavioral, emotional, cognitive, social, cultural well-being. Where are the strengths? Where are the challenges? What do we know? And what might we need to be curious about? What don't we know? What do we need to know more about? And then we move on to the second domain and we think about the quality of caregiving that this child is receiving. Who are the key caregivers to them? What relationship do they have? Are they in the primary care of caregivers? Are they in shared care arrangements? And what's the quality there? So we're thinking about nurturance, we're thinking about the quality of attachment, but we think about it in terms of emotional availability, the day-to-day interactions that we can observe between a parent and child. And I'm just going to show you a little video. This is an example of a sort of video piece we might use in training. It's something that's taken off social media. It's highly accessible. A lot of people may have even seen it within the last couple of years doing the rounds. And what we help people to do is think about an everyday piece of interaction that they might see through the lens of noticing the parent and child behaviors and understanding what those tell us about emotional availability. So I'm just going to play you this little video.
Okay. They need to work on that, right? Yes, okay. Did you understand it though? No. Okay. All right. Huh? Oh, no, not this one. This is the grand finale of this. Yeah, that's the last one. That's what I was wondering. I don't know what they're gonna do next season because they did some stuff this time. Exactly what I was thinking. Oh yeah. Right. Don't bring that again. You know what I'm saying? Don't do the same stuff. You know what I'm saying? Yeah, I was thinking that. Yeah. Yeah. Like go somewhere else with that, but don't bring it here. You know what I'm saying? Yeah. That's what I said. And then it was like, you know what I'm saying? And I was like, what in the world? But don't do it here. You know what I'm saying? Yeah. Really? I thought the same thing. We think a lot alike, huh? Oh, that's crazy. Right.
And so typically we would show a lot of videos, some with very positive interaction, some with more challenging interaction. And we would introduce this idea about emotional availability as a way of accessing an understanding, a way of assessing, a way of making sense of what we see that we can look at in everyday situations with families. And we would first of all ask trainees to notice what's evoked for them by the interaction that they've seen. So holding on to the little piece that we've just seen there between dad and his little one watching sports on TV, we would think about what's evoked for us, and then we would start to talk about what we've just seen. And we would break it down into the different aspects. We would think about his sensitivity, the parental sensitivity, that capacity to be warm and emotionally connected. And I would ask people to think about the interaction they've seen through that lens initially. And we would think about the fact that what we've seen here is a father who's genuinely enjoying the company of his child. There's a relaxed congruence in their interaction, aware of cues, responding well, giving space, giving time, accepting and respectful. And there's clearly a comfort between them. And then we would move on to other aspects of emotional availability. We would think about structuring, the capacity to scaffold the interaction, the parent's capacity to provide scaffolding for their child, for their infant. We would look at it in terms of the scaffolding of language development, that there weren't any words from the little one, but it was a full conversation. It was a beautiful dialogue, in fact. And we look at the way in which that's unforced, the quality of it, the fact that it's being well received by the child in this instance. And develop a language for practitioners around these constructs of emotional availability. And we would also then start to think about, when we look at the infant, when we look at the child, what behaviors are we seeing there? What levels of involvement, what levels of responsivity are we seeing? How much is the child inviting the parent in? And what's the quality of their responses to the parent's bids for interaction? And what we're seeing in this clip that we just showed you is a really beautiful quality of participation, of the child inviting, pointing, gesturing. There are pauses in the dialogue and the conversation between them. And then the child opens up again and gestures and points and is very engaging and is very much given the space to lead. So that's how we would start thinking about this second domain, the yellow domain of emotional availability, the quality of caregiving. And then what the slide I'm showing at the moment is adding in another domain. This is our third domain, the blue circle, if you like, where we're thinking about, part of this is around day-to-day parenting knowledge and skills, family routines, monitoring of children, safe monitoring. But it also points to something that is a really key aspect of what we are wanting our practitioners to be explicitly showing their curiosity about with parents, thinking about parenting values and expectations, somebody's values around family life, their sense that they can choose the sort of parent they want to be, their expectations about themselves, their view of self as parent. Do they have a sense of their own efficacy as a parent? So we have explicit guidance and prompts for opening up dialogue and conversation, therapeutic conversation about these areas. These two domains combined, the yellow and the blue, become, if you like, the direct influences on a child's well-being at any point in time. The quality of caregiving and the parenting values and expectations combined with day-to-day parenting capacity. However, impacting on those, and therefore on the well-being of children, are the next three domains that we add into the framework. And the first of those, parent emotion regulation. So we're now thinking about the parent in their own right. We're turning our gaze to them, to the caregiver, and being curious about their state of mind. How do they present? How do they do problem solving? What happens to them when adversity comes along? Are they somebody that can manage that? Are they somebody that gets overwhelmed? Are they somebody that shuts down in the face of that? Do they experience low mood? Do they experience anxiety? Do they experience high stress? We need to know these things because we're thinking about the impact of a parent's state of mind on their capacity to do the inner circle stuff for their children. And then domain 5 we're adding in now is that parent's sense of connection. What's the quality of the relationships around them? How isolated or supported do they feel in relation to their partner relationships, to their family, to their community, to their culture. And this one is, yes, absolutely around how supported or unsupported somebody feels, but also almost their sense of entitlement to hold their head up the same as anybody else. Are they somebody that feels that if they're referred into to a children's centre, that they've as much right as anybody to be there? Or are they somebody that feels, well, that's not for me, that's for other people? What's their sense of alienation, stigmatization, or connection? How problematic is that? And then the last domain that we're adding in is the ecological context. Are there community resources available to this family? Are they engaged? What prevents that? What supports or prevents that engagement with community resources? And what real world adversity and problems might they be living with right now? What significant life events may have happened? And it's only when we build up a picture around these 6 domains of the framework that we're able to think, okay, so building up a conversation with the family around all of these areas gives us a context to then think with the caregiver, with the parent, about how they understand the presenting strengths and difficulties that they have. And that's how we would then tailor the intervention to think, do we in fact, in order to support a greater emotional availability or a greater stability in day-to-day parenting routines, do we in fact need to really focus on a parent's emotional regulation and the quality of their support networks alongside the focus on day-to-day parenting quality? So I think I'm going to hand back to Sharon at this point. Thank you.
So one of our catchphrases in PUP is that we want children to be the best that they can be. And so if ultimately our goal is to help children have the best developmental outcomes they can, what we can do is engage with parents through that process. And one of the things that people often ask us is, how do you start working with parents around emotion regulation? And again, this becomes part of a kind of making sense of the family story, if you like, where you need to be clear about, in your own mind as a practitioner, that parental emotion regulation is really a key issue in this family, which is affecting the child's capacity to regulate. So the co-regulation piece is very, very problematic. So rather than trying to work maybe directly initially with a mum, you might be working with mum who's working with her little 5-year-old. And so the process becomes one in which your case conceptualization is around the fact that this child's emotional dysregulation is in a large part due to a lack of structure and family routines, but equally is due to a lack of exposure to anybody in their own family who's modeling emotion regulation. And so there your conceptualization about this particular case would inform where you would do your individualized treatment program. It's an important component of the PUP program, this notion of case formulation is often what it's called in clinical psychology. We typically call it making sense of all of the information. And that's the kind of language that we would also use with families. So there's a lot going on here. And we've got a family version of this ITF. We say we've got a lot going on here. If you think about all of these different stresses and strains, and also some of the great things that's happening in this family, we can kind of make sense of how we're going to start working with little Johnny, 5-year-old Johnny, to help him become a little bit more settled in the school setting. So that I think is really kind of key, I guess, to the PUP program, isn't it? That notion of making sense of the information. It's not just simply gathering descriptive information, it's then about hypothesis generation, if you like. So I'm going to just talk a teeny weeny bit now about some of the research studies. So we've done enough to give us some reasonable ticks on evidence-based. We're very we're still in the early stages really, but we've got enough randomized controlled trials. We've got 2 randomized controlled trials and 1 quasi-experimental. And you'll just see there that across all those 3 studies, plus a series of single case studies that we've done with different populations, we tend to get, interestingly, rather similar results. We typically find that about 1/3 of the families do really, really well. And that's using reliable change index for those of you who've done some of the evaluations that are around RCTs. We tend to use reliable change index. So what we see is 1/3 of families do really, really well. 1/3 of families make some gains, but we don't know how long those gains are going to remain. And 1/3 of the families make no change or deteriorate. And I think really our big question going forward is, what can we do differently for those families where there's no change or deterioration? That's that 1/3 families. And look, remembering also that the families that we work with are really complex. Almost all of them are in child protection. The parents themselves have had histories of trauma. There's considerable financial difficulties. And for many of the families that we work with in Australia with Indigenous organisations, there's intergenerational trauma, displacement, and a history of colonisation that brings a whole set of new problems with it. So I think, you know, we also have to be realistic, and if our key goal is to help children's lives be the best that they can be, sometimes we have to accept that we actually can't change the family as they are. PUP's cost effective, so the whole health economics piece is really critical to the family support field. Governments across the world, and certainly Australia, are asking more and more, what are we getting for our money? Should we keep doing this? And I think it's absolutely imperative for all of us in the child and family arena to embed health economics arguments into our advocacy work. More recently, we've turned our attention to working with dads. And this is a study that we did in Scotland with my colleague Anne Whitaker led this. And she was curious as to whether or not she could even get dads to come along. So these were fathers in opioid replacement therapy. So they were in a national health system addiction facility as an outpatient. They would pick up their methadone or buprenorphine on a daily basis. They were 2nd, 3rd generation of unemployed men with long histories of engagement in the prison system. They're really tough guys to work with, really tough. Were they even prepared to come along? Well, about 2/3 of them, yes. Did they stay? Yes, quite a few of them did. Did they make any treatment gains? Yes, they did. So, you know, the ability for the practitioners and this community organization to engage with dads and retain dads in treatment was really quite phenomenal, and I think an important area for us in the family support field. We often forget about poor old dads. Okay, so how does PUP work? I'm just going to share, yes, we've got a few minutes left. I'm just going to share with you some our curiosity around what really makes PUP work. And so what you see here, okay, so what you see here are the results of an investigation that we did of the randomized controlled trial. Here we were very curious about the pink circle, parental emotion regulation. And can we change that, was our first question. This comes from the Barlow RCT. Can we change that? And we've demonstrated that we could. But really, we were interested in the relationship between parental emotion regulation and child abuse potential. And what you see there in that model is that for the parents who improved emotion regulation at time 2, you saw an improvement in child abuse potential at time 3. So what you're arguing there is that your mechanism of change is around improving parental emotion regulation. I just retained these two slides on the cost effectiveness because I just wanted to give an opportunity for people to have a sense of how we went about doing that. We looked at, this was led by health economists, and what they did was look at a cost effectiveness analysis. And they arrived at estimate, if they used an estimate of 1 in 5 cases of maltreatment is prevented, how much money does the Australian government save? And there you'll see the savings estimate. We also did a cost effectiveness component in the UK study. So the first question in this analysis was, is PUP more expensive? And yes, it is, but by not a huge amount compared to treatment as usual. Now, again, I think it's important to contextualize treatment as usual. In the UK, treatment as usual is actually quite good. There are really nice family centres that are set up. Many of these family centres were running parenting groups and offering support. So treatment as usual was not nothing. It was actually a reasonably sort of solid kind of family centre process. So again, I guess that goes to the issue that PUP wasn't really that much more expensive because there was already quite a lot on offer. But regardless, when they looked at incremental cost effectiveness, it was found to perform far better than a range of other parenting programs that had had a similar kind of analysis done. I'm just going to skip over that one because we've talked about it already. The other area that we were very curious about was whether or not we could improve parental well-being by using mindfulness strategies. And so what we did in this particular study of 166 families, we looked at the therapeutic process of change. And one of the key ways that we are supporting parents to manage their own emotions is by the introduction of mindfulness strategies. Sometimes these mindfulness strategies are very structured, and for those of you familiar with mindful eating, mindful walking, they were certainly things that we were engaged with. But we're also interested in incidental opportunities to do mindfulness. So for example, if a mum was holding her baby, we may say something like, oh, your baby's really settled, and why don't you just hold her for a little bit longer? Maybe the baby had just been fed. So she's there on mum's shoulder, and the practitioner would say, don't put her down straight away. Why don't we just hold her for a few minutes and just have a little think and listen to her breath and stroke her and notice her, how settled she is, how safe she's feeling. And so really what you're doing is bringing awareness to the present moment in a way that is non-judgmental, and is allowing the parent to start to practice that being fully present experience. So we do both informal and formal mindful practices. This is the data that we've just got in press in the journal called Mindfulness, and this will be publicly available. A little complicated again, these cross-lagged models, but essentially if you look at the top line, you'll see that parental psychopathology, in this case, the depression, anxiety, and stress score predicted change. So it changed across time, as did mindful parenting. But the arrow that is particularly important, unfortunately not highlighted, but if you look at time 2 parental psychopathology to time 3 mindful parenting, you'll find that that path is significant, which means that in a similar way to the previous diagram, those parents who had a decrease in parental psychopathology at time 2 showed an improvement in mindful parenting scores at time 3. So again, what we're able to tease out in a sense with these cross-lagged models is what happens first. And I think for us, this has really underscored the importance of the pink circle and how key that is to helping families become more regulated. The final little bit of our talk today is kind of zooming back out a little bit and saying whatever you're doing with families, we ask practitioners to think about the 3 threads of the PUP model. And the 3 threads are whatever you're doing, what we're wanting, whether it's doing a visit to a housing office, whether it's doing a school visit with a mum, whether it's helping her get some warm clothes and bedding for the winter that's coming up, even these very pragmatic kind of tasks involve the 3 threads. And what the practitioner is doing is along the way helping mum or the caregiver to develop emotion regulation. Along the way, it's about helping the parent become more nurturing or recognizing their own capacity for nurturance when they were nurturing, and to improve that view of self as parent, to move from I'm a rubbish parent, my kids have been taken off me, I'm using drugs, or I used drugs when I was pregnant, to a far more positive view, which is not to deny that those things have happened, but to have a more empowering view of self, which is, and I can be a good mum, and I am a good mum. So these 3 threads were made into 3 short animations. This was an experience of co-design that involved Paul and I working with the director and producer of these animations in Central Australia, alongside an Indigenous psychologist who had extensive experience in working with trauma, and the family support team from Aboriginal Congress in the center of the desert. Now, for any of you who have any idea about what Australia looks like, there's a very, 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 very large desert. It's very flat. It's very hot much of the year. And it's also very beautiful. It's got wonderful reds and ochres and oranges in the landscape. And so what I'm going to show you now is, first of all, our own little experience of co-design. And here you'll see us in the studio of our director, which is basically his living room. They're out there in Alice Springs, puzzling and trying to figure out how we were going to make something that was helpful to the families that we were working with. I might just play this just a sec.
Being a part of the conversation last time, I was actually watching for his mood to get a bit defensive.
Yes.
When he got there, and then she said that.
Yes, it was mentioned last time, and now it's just been added to a bit more.
Yeah.
So we had to develop the storyline and develop the script and really test it out. And between the very large group of us, we kind of arrived at a interesting, and I think very unexpected for me, outcome, which is a series of videos and animations that take those 3 threads. I'm going to finish with showing you the clip that I always think is the clip about what didn't happen. And so I'll leave it for you to make some determinations about what didn't happen in this situation.
That mechanic was fixing my car real slow. I shouldn't have given him all that money. And that's the last bit of money I had. I've always got no money. I'm stupid doing that. I'm gonna be late now. My wife must be thinking what happened to me. She's on my back all the time.
You've been out all night. What happened?
I'm so stupid. I'm gonna be late now. What am I doing to myself?
You've been out all night. What happened? You've been out all night. What happened? I've been worried about you.
Come over here. I'm all right.
Okay, well, we now have some time for questions and answers, which I think Andrea is going to lead on.
Yes, thank you so much, Sharon and Jenny. We'll now move on to the discussion portion of the webinar to address any audience questions. And just as a reminder, you can enter your questions in the Q&A section of the down below on your Zoom screen. And we have 3 so far. The first one is from Susan Jack, even though it says anonymous attendee. I know it's from Susan. And I also want to thank Susan for helping co-organize this webinar as well. And she's asking, do you have any tips on practical strategies on how to elicit and learn the family's story on the first few visits?
That's a really lovely question, and it brings us to we have quite a lot of resources that we give to our practitioners in PUP. So they have their own practice manuals, but they also have workbooks that they can use as they want to with parents. And those all start with a section called a module called Starting Your PUP Journey. And it takes each of the domains of family functioning and offers prompts for conversation to open up dialogue in quite specific and explicit ways around those domains. So it would ask things like, in the domain of child development, it would say, tell me about your child. How healthy and strong are they? How able are they to, do they enjoy singing and dancing? Do they make friends? So you open up conversations, not necessarily problem-focused conversations about these different areas with an explanation that goes, there's an introduction sort of script, if you like, about how you would introduce PUP. And the parents will have all the same information available to them if they have a copy of the workbook. And it will say, parenting is influenced by so many different things. Let's think about all the different things that are influencing your situation at the moment. So it just becomes a conversational dialogue in that way, and similarly for each of the domains. So we have what we call the Starting Your PUP Journey worksheets.
Great, thank you, Jenny. The second question is, does your program work with many fathers? So I know you reported some of the work that was just completed in Scotland. because there's a real gap in services for fathers who are parenting, that's for sure.
Yeah. Yeah, it does. I think the fathers that we worked with, the dads we worked with in Scotland were about as tough as you get, but we've worked with fathers in other settings. Increasingly in Australia, we're having people employed, typically men, but not always, as fathers workers. And increasingly we're getting men, encouraging men to come into the family support field. And so in that little clip that you saw of us all doing the co-design, the man on the front left, Dudley, was one of the Indigenous family support workers, and he was working explicitly with men. So I think it is a space that we need men to step up and take over and own in a way, and to stop parenting programs becoming just mothering programs.
I'm going to just quickly add in, I think something that was really powerful in the feedback from practitioners and fathers was the value, certainly for fathers who typically had a self-narrative around criminal justice and addiction, and felt that the services they went to also carried that narrative about them, that they were then asked about their values as a parent, their view of themselves as a parent. And that was a really, really powerful, thinking about that, starting your PUP journey, that question around what does it feel like to think of yourself as a dad? So dads who are not resident with their children, who only have sporadic contact with their children, but are wanting to establish more contact. That became a really powerful part, not only of their recovery in their addiction journey, but of their sense of connecting back into their sense of themselves as a father, as a parent.
Okay, great, thank you. Another question, unless it was missed, and I don't know that you spoke about it in this presentation actually, but who delivers PUP? So is it delivered by professionals like public health nurses? I know we have a lot of public health units and likely a lot of public health nurses who do a lot of home visiting, or by paraprofessionals, for example, family and lay home visitors.
So the terminology that we have in Australia and the UK is, it's called family support practitioners. And family support practitioners are typically, but not always, people with community experience. They may have a background in social work, but many of them don't. Many of them may have had some previous experience in working perhaps in residential facilities and youth justice as probation officers, etc. So, and many will be senior community members in their own community, and particularly for Indigenous communities. So the PUP model is really tailored, and the PUP training is really tailored for people who do not necessarily come in with formal qualifications and formal educational background, but do come in with really strong therapeutic alliance skills. They are committed to the field, they're committed to working with families, and they're good at building relationships. So we provide, if you like, a theoretical framework and a suite of resources and tools that they can start to use to build some more structure in their family support.
Thanks, Sharon. The next question is about training actually, and how it's delivered. And I'm wondering if you could also, just from a practical standpoint, very briefly talk about like what PUP looks like actually in the field, not only the training component, but perhaps the modules and the resources and tools that you just sort of referred to.
Why don't you do training and I'll do the
other. We're gonna double tag the answer.
You do training. You do the first bit, I'll do the second bit.
From the outset, we followed a training model, which is quite a lengthy one because it involves a lot of implementation support. So we do 2 initial training days, quite close to each other, usually back to back if we can. That covers all the core components of the model. And then we, over an 8-month period, invite people back together, not invite people back together at months 1, 2, 4, 6, and 8 for seminar days where we bring more content, but also importantly, we problem solve about how are they finding it in practice. We require people during that training process to work with 3 families in order to have the experience of how tailored it is for each one. We require them to use an online toolkit of resources that we have to upload information there, to use standardized measures and score questionnaires that we embed with a feedback system in the online toolkit as well. And they write up one piece of work they've done as quite a detailed case study in order to get their accreditation as a practitioner at the end of that 8-month process. So that's the training model.
How it looks in practice is, oh gosh, a million different ways, really. The idea is that you take the framework, you take the resources and the toolkit, and you adapt it and help it work in your community. So for some families in Brisbane, there would be an agency, a third sector agency that is funded to provide support to families who are on the edge of care. So this is families where there's high risk of engagement in child protection. And those families would be worked with one-on-one. Practitioners would go to their homes. Initially, you might do several sessions a week, or you do sessions with text messaging, phone calls, etc. And then over a period of 6 months, you might actually reduce the number of sessions. The parents may well use the parent workbook. That is a kind of judgment call that you need to make. The parent workbook has 12 modules, and as a practitioner, when you do your individual formulation, you decide which modules are going to be most relevant for this family and what's going to support your collaborative goal setting. So that's kind of like a very kind of traditional way of doing PUP. I've done lots of work in Central Australia. You would very rarely bring out a piece of written work like a parent workbook. A lot of the time you're sitting with families, and I've done home visits with practitioners to these families, and sometimes you are literally sitting in the dirt underneath a tree and you're just talking, and then maybe you're drawing. And in fact, we've even had situations where our practitioner has drawn out the integrated theoretical framework in the space where we were sitting and talking about, you know, your kids are really good and strong, have got strong bodies and are doing really great here, but you know, somewhere here they're not, are they feeling as loved as they are, and what's happening here, because you're out drinking a lot at night and there's nobody's got their eyes on the kids, etc. So that would look really different in that setting. So we invite practitioners to learn the framework, to learn what all of the tools are, and then to adapt them for their own setting.
Great, thank you. I know it's hard to describe it all in a little snapshot. So I think Sarah has a question. So
yeah, I actually have a question. So thank you very much for that excellent presentation. There's a lot of public health practitioners on this call, I know. And one of the challenges we've had in our parenting programs is about accessing the right population to meet the program. And your evidence and research is really based on super complex families, which we do try to target, but we also do have a huge swath of the population that might not be as complex, but also would really benefit from parenting support and all of the theoretical framework that you have described. Have you thought about doing some evaluation studies in a lesser complex population, or how do you think that this program might fit with different families?
I think the program would fit with a whole range of different families. There's also agencies that have been funded for secondary prevention or rather than tertiary or targeted intervention kind of processes, and they also use the PUP program. They've got a group in South Australia actually that have been funded for delivery of PUP to families who are struggling but are not currently engaged in the child protection system. And I think that's really an important place for us to start turning our attention to, Sarah. You know, we keep on trying to kind of rescue people at the bottom of the cliff. You know, let's put the gates up on the fences up on the top of the cliff and do some more work around quite vulnerable families that have not yet reached catastrophe stage. I agree. Yeah.
And I think really quickly add in, I think a really key piece in that is building up parental self-efficacy. The more we can do to support somebody's view of themselves as a parent and their confidence, I think that's a really, really strong builder of resilience in the family at a point when if we can work with the parent to take stock and support that. Yeah.
Great, thank you so much.
Thanks. I'm very cognizant of the time. We only have a couple minutes left of questions, and there's quite a few excellent questions in the chat. So I'll just jump to one about the connection to culture in the framework seems to really resonate with Australian and Canadian colonial contexts. And I thought the same when we saw your video. Could you elaborate on what connection to culture looks like in the intervention and what impacts it might have in relation to outcome?
Okay, so connection to culture is not our call. So we wouldn't say this is how you should do PUP in any particular cultural context. What we say is there's some universals. All children need to be loved, all children need to be fed, all children need to have parents who can kind of manage how they're feeling and not blow up and not hit and not shout. What does that look like for you guys? And so then when you're working in, so for example, in Indigenous cultures, there are many people in a family network, and the person who has, or the two people who have maybe the primary caregiving responsibility may not necessarily be the biological mother. And so really what we need to do is work with the practitioners who are working in that setting to work out who should be involved, how is it best to be involved, who do you ask for advice, who do you involve initially, who do you then move to next. So the cultural piece really depends, it's very much driven by the organization and the peoples who are involved. So we also do actually a lot of work in Dublin where we've got the traveling community. The traveling community used to be known as the gypsy population. It's a very disadvantaged, disenfranchised and traumatized group of people often. I don't want to say always, but often. And so, but that experience shares some similarities with First Nations peoples across the world, but it's also embedded in a very rich cultural heritage that's unique to them, and that needs to be worked with the practitioners rather than us as program developers saying this is how you should do it, I think. Yeah.
Great, thank you. We're very close, so I'll just hand it over to Sarah, but thank you.
Okay, thank you. As we wrap up today's webinar, I would like to thank Professor Sharon Daw and Jenny Carpenter for presenting. That was wonderful. And also Dr. Gonzalez for co-moderating. I'd like to thank everyone also who joined us today. You can expect to receive a brief and anonymous survey for today's session, so please try and complete this to help us improve our programming. I also want to give 2 plugs to upcoming webinars in this series. So on October 19th, Nadine Wathen will be presenting on creating safety during home visits, an introduction to trauma and violence-informed care. And on November 9th, Susan Jack will be presenting on a trauma and violence-informed approach to completing sensitive assessments with pregnant individuals and parents. They'll both be at the same time, 9:30 a.m. And so we'd really like to see everyone there as well. Thank you and have a wonderful day.